Good evening, Glenn Reeves here from Coastal Immunology and the Autoimmune Resource and Research Centre, providing another update for our patients with autoimmune conditions who share ongoing concerns about the current COVID situation. I am agitated by the premature claims that have been made of miraculous effects of various medications in treating or preventing COVID-19 disease. And these claims are causing effects which are creating real harm at a social level. We are receiving distressed and distressing calls from patients who are in real need of Plaquenil, hydroxychloroquine, the anti-malarial drug used for lupus and other immune conditions, and who cannot secure the drug, partly because of the release of very poor quality data, not to mention the statement from a certain president that the combination of hydroxychloroquine and another drug, which I won't name so that we don't have a run on that, has a real chance to be one of the biggest game changers in the history of medicine. The truth is that there's currently no data, certainly no high quality data, to support the use of Plaquenil in the use of COVID, either for prevention or for therapy. Indeed, there's data from China suggesting absolutely no benefit, and we have to be aware that every medication has side effects. So, for example, hydroxychloroquine or Plaquenil can rarely have side effects with regard to heart and muscle. Not common. Certainly the eye side effect is another very rare one, and we need to balance benefit against risk. Currently, there is no evidence of benefit from Plaquenil. All we've got is anecdotes and uncontrolled studies, which are no better than the spruikings of a medicine man wielding potions. So in our practice, we advocate on behalf of sufferers or people experiencing autoimmune disease, and we are liaising with various pharmaceutical companies and suppliers and distributors, as well as the Pharmaceutical Society of Australia and various government representatives to help overcome what is a trough in the treatment supply. Meanwhile, we know supplies do exist, albeit requiring an amount of ringing around. Your pharmacist knows of this problem of inappropriate prescribing, and some people are doing the uncountenanced activities of hoarding medications for friends and family, based partly upon panic. And we are working to ensure that the provision or filling of inappropriate scripts provided to people who will try anything is not pursued, so that valuable stocks are available for those people who actually need the medication for real indications. We need to, and we are, increasing public and medical education about the hazards of practicing based upon anecdote or poor quality. And if you happen to use Dr. Google, who is readily available, often more available than your specialist or GP because of constraints with resources, then please ensure that on Dr. Google you consult web links that have reliable information. So, for example, the ASCIA website, the Australasian Society of Clinical Immunology and Allergy, or the ARA, the Australian Rheumatological Association. These are to be preferred over sites that you might punch in saying covidcure.com. Please avoid these, and if you have temporary difficulties securing your supply, consider the options after speaking with your primary or specialist carer to cover what might be slight difficulties or hiatuses in supply. Now, the options might include, after appropriate discussion, slight dosage reduction of the Plaquenil, so for example from 2 tablets down to 1.5, or even temporary escalation of a corticosteroid. But we all know that that's not desirable in the long run, and you should talk to your doctor before doing such things. The good news, though, is that the action is being taken. The trough will pass, and the half-life of the drug means that while not desirable, an interruption in supply of up to 7 to 10 days, if it were to occur, and hopefully it wouldn't, would not be a catastrophe. Further updates will appear on our websites soon, so visit coastalimmunology.com.au or the Autoimmune Resource Centre website at autoimmune.org.au. Now, whilst exceeding now 1 million cases and exceeding 50,000 deaths, there are some promising signs that public health measures are kicking in, and we still have a long road ahead. But if we all share our resources wisely and thoughtfully, we will get through this together. I'll keep you posted. Best wishes to everyone. Stay well, stay home.